You and your friend says, "Hey, I had a root canal done and everything is good." And you had a root canal done and you're like in hospital, you know, and now you've got poisoning. It's a true story, but it happens sometimes. Today on Heels,
Hills talk.
we'll be talking about why everybody responds to things differently. My name is Surprise,
And I'm Dr. Craig.
and let's get to it.
Uh, can you shut up?
So, why don't people respond the same to the same treatment?
Well, everyone is different. Even among siblings, you will have like slightly different features. Like, oh, you look like your mom and you look like your dad. You both look like your mom and you look like your dad, but different still. Those little things like fingerprints are different, and thus the internal works are also different. So if I punch this guy and I punch his brother, almost said sister,
Yes.
but she's unpunchable. Uh, they might react differently as well. And so that's basically about it. When you think about like dentistry, we have very few procedures that we do on a daily. There will be cleanings, there will be extractions, there will be fillings, there will be uh, root planing, like a deep clean. Um, what else? Like implants,
Hmm.
crowns, veneers. But
Orthodontics.
orthodontics, but there's basically hundreds and thousands of people in Johannesburg that we will treat, millions around the world. Uh, and we can't necessarily just like have this running template for everyone.
Mhm.
So each person will have a unique thing that they will need. So even though you can teach a monkey how to do my job, the one thing that makes me necessary is figuring out what do you need in particular, which one of from those little things will work best for you.
Yeah, and this is an interesting one, you know. Remember that module, anatomy?
Hmm.
Oh, did you love it?
It was a love-hate relationship.
Yeah, yeah. But anyway, anatomy is what? The study of the human body, even animal body, whatever. But people have different anatomies, For example, people's muscles attach differently, It's like there is a standard, there is a standard we all follow as human beings, but there are slight variations, right? And variations could be how much bacteria is in your mouth, what type of bacteria is in your mouth, um, what type of bacteria is in your tooth. That's why you might do a root canal and it might fail, and your next door neighbor did like 16 and he's like, what? It's great procedure. Now you're going down the rabbit hole of saying root canals are a scam, they cause cancer. But it's because you might have a certain type of bacteria that doesn't that needs deeper treating. And these are the things that make treatment different. You and your brother could get braces, and your brother just has something which is done within 16 months, and you might need to get surgery and uh, all types of elastics. But it happens because you have the same genes, but they have expressed themselves very differently.
Yeah. And I think we see it a lot with our braces patient. Like they could be family. One is done in like 10 months, and the other will probably still have them for a couple of more months. So that's just how it is. Everyone is different. And still speaking on this topic, you do get some patients that are like, okay, I hope you treat me well because my last dentist was pretty shitty. But like, I don't know. Like, I don't know a lot of shitty dentists. Like, and the ones that I could be like, you're shitty. They're just probably like just insane, even in the real world. Just a little bit crazy, a little screw loose. But even, yeah, clinically, I wouldn't know because we're trained basically using the same standard. A filling that you get here is pretty similar to the filling you will get in Cape Town. And the materials also pretty much the same,
Hmm.
but you might get some sensitivity while the other person's like, oh, this is great. And that filling might last 15 years while you'll have to redo yours maybe every 5 years. So that's just how uniquely built you are.
And this gets to this is interesting about fillings, because there are people who've had fillings for years and years. And then there's people who've had fillings for 2 years and it starts to get sensitive or it's leaking. And again, it goes back to the bacteria in your mouth, the way you bite. Some people have a very aggressive bite. And all those things play a factor in how your dental work will age, what dental work will work for you and what doesn't work for you. Like, those people, you do a fixed retainer and then they come back in 2 days. And then these people have had them for like 20 years and say, please take this thing out. It's just differing, those small differences, like the way you bite. Very, very, very unique thing.
Exactly. Also, pain threshold. So one person could get like a tiny little cavity and they can't eat. It's painful. It's sensitive. Or whenever I have something like cold or hot, they can't bear it. And there's some people with like a cavity of the Grand Canyon. It's like really big. And in fact, I wouldn't even call it a tooth anymore. It's just like a little floating root. And like, I don't know what happened. I was having like sushi and this thing just like kind of chipped. That's just how it is. I don't know the mysteries of why it is so, but it is so. So chances are that you bumped into a very crappy, horrible dentist along the way. Chances are slim.
Uh-huh.
It's just you. And it's not your fault.
It's not
Your
your
body
fault.
does what your body does.
And on the topic of dentists, remember, because you're different, we can anticipate. In fact, this has just happened to me 20 minutes ago. You do that root canal, you're thinking 3 openings and then it says 2, and you start drilling, you're looking for more. So you might have a different type of anatomy. And because of that, when we start working, it makes it very difficult for us, And you're like, why is this guy struggling so much? Again, you're built differently and you've got your own unique traits and your own unique anatomy. So, yeah, chances are your dentist wasn't bad. I think the thing they lacked in was communication. And I think that's something dentists should actually work on, including me. Mm.
Yeah, me too. And sometimes I also just like jump into work. I'm like, okay, your teeth are messed up. You are going to need 3 extractions, 3 fillings, a cleaning, and you might need some braces afterwards. And I give like a little like uh consent thingy, but like not going into details of like everything you might experience. And, you come back later with some issues, but that's just, that's on our side. And we should probably work on that, or maybe just create longer appointments to just like have a deep 15-minute talk, or you could just watch these videos.
Yeah.
Because like, I think we've mentioned a couple of terminologies here, but we've also done like a couple of videos on like what is gum disease, what is root planing, and downside of fillings, the spiraling hill of just dentistry and all things that could go wrong. So once you see this video and you're like, what's that? Just check out our other videos, and I think you might get some insight on that. So this video is kind of long, and we decided we're going to split it into 2. So the first part, it was us talking about what you might experience differently as patients. And on part 2, we're going to talk about why I would give you a treatment plan and then surprise with the same logo, same class. And I think we relatively did the same way in class, same grades, and we went, right?
Top of the grade.
As long as our professors are not watching this. Like,
Yeah.
yeah, I was top of the class. Yeah.
But by the way,
Class.
I know this, but I had an embarrassing moment. Prof came yesterday.
Uh-huh.
So he's like, so how you gonna do this? I said, I'll do the jaw registration.
Mhm.
This is a technical thing. And the secondary impressions in one day. Did my man not put a face on me? Like,
Oh, yeah.
how dare you?
Yeah.
He looked
Yeah,
at me. He judged me. I was like, no.
Yeah. So one of our favorite things here, we work with like 3 of our lecturers from varsity. So it's pretty interesting sometimes. And they still try to ask us those questions. And you're like, what? Well, I skipped that class, skipped that while. But no, don't worry about it. We're still very good dentists.
Yeah.
Very good. Tom, Yeah, very good. Yeah, check the reviews.
Yeah, extremely good. Yeah, we've got a camera.
Yeah, that's the standard. Like you see this mic. Yeah, that's the standard. That's how you check a good dentist. So on the second part, we'll be talking about why different dentists would give you different treatment plans, and why both of them might be right.